Okay, doesn't look like there's any questions or comments now. So really, this is just a disclaimer to say that this is independent research funded by the National Institute for Health and Care Research. So the views expressed in this publication and presentation are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. Okay, just a couple of warm-up questions. There's not going to be much explanation to these. We will explain a bit further in the next presentation. But your first question to you to get your brain cells working, how much do you think a GP appointment costs? If we press the button, we can see that it costs £45. Okay, on the next slide, we have a second question for you to think about. How much do you think 1 week of local authority residential care costs? Are you close, Olivia, then with your GP estimation? So the answer for this one is £1,812. Okay, I will move on to the presentation now where we'll go into a bit more depth about unit costs. And I'll hand over to Karen.
Hi, hi everyone. So I'm Karen Jones from the Care and Outcomes Research Centre at the University of Kent. We were previously were known as the Personal Social Services Research Unit, PSSRU, but we last year we had a rebrand. So as Sarah has highlighted, I'm the principal investigator for the current unit cost programme, and many thanks for attending this webinar. So what do we mean by unit costs? So for social care services, this could be the cost for a week in a nursing or residential care home, or a visit to a day centre. For healthcare services, the unit costs could be for a planned hospital stay or an outpatient procedure. And finally, for the workforce, so nurses or doctors, physiotherapists, the unit cost would be the hourly cost for that professional. So next slide, please. So I wanted to give you, I wanted to talk about an everyday example of how we would calculate a unit cost for a biscuit. So if we spend £10 on ingredients to make 20 biscuits, to find the unit cost, we would divide the total cost by the number of biscuits. So the unit cost per biscuit would be 50p. And so if you were making more than 20, that cost would go down. Next slide, please. So in terms of what we do in the programme, actually estimating unit costs for health and social care services. So if we take residential care for older people in 2025, so our last year's estimations would have been based on 2024 data. So the total local authority expenditure for the week was 1,368 in terms, and then in total it was 1,368. So that includes total local authority expenditure, building and on costs. So building costs are based on new land and build requirements for local authority care establishments, and on costs consists of essential associated costs such as the the employer's national insurance contributions. So for establishment costs, this would be £1,753 per week, and for the establishment costs plus living expenses, that would be £1,812 per week. Next slide, please. So finally, let's look at GP unit costs. So in 2024, a GP costs £332,398 per week, and that's including direct care and qualification costs. In 2024, GPs worked 2,064 hours per year on average. So we would find the unit cost by dividing the total cost per year by the number of hours per year. So it would cost £161 per GMS hours, and this is for general medical services. And then we would calculate £45 per surgery consultation based on 10 minutes per consultation. Next slide, please. So we, in our programme and the manual, we estimate unit costs for a number of other services, such as NHS wheelchair costs, specialist supported housing, training costs for doctors, and NHS dental charges. So in the manual, we cover a lot of care services and workforce and cost for work, the health and social care workforce. Next slide, please. So who uses our unit cost estimations? So we know that the Department of Health and Social Care uses our estimations. We're aware that health and social care providers also use our estimations, and also we're fully aware of academics using our unit costs for a project or evaluation. And finally, NICE, the National Institute for Health and Care Excellence, they also use our costs for economic evaluations. So that's how we estimate. So now I'm going to hand over to Sarah Birch, who will present on why unit costs matter to the public.
Great, thank you, Karen. Okay, so I'm going to be asking the question, why are unit costs important to members of the public? So within the PPIE team, so our patient and public involvement and engagement team, we've thought of some examples of where unit costs are used or considered by the general public, and how we believe this programme is of importance to the public. So on the next slide, you'll see sort of the first of one of our examples. So firstly, many people have a general interest in the budgets and the spending within their country of residence, so especially when it comes to health and social care. This is demonstrated by the generation of highly viewed news articles, so such as the one published on BBC News last February, and this had the headline, "How much is the NHS going to cost us?" So the cost of health and social care does generate discussion and debate, especially when we see spending rising, as this graph shows on the right, where the UK health spend has increased for decades since the 1950s to the present day, with this trend to continue as our population ages and people demand access to new medicines and treatment. On the next slide, for those who may wish to delve a bit deeper into such costs to understand the spending trends, there are these highly accessed website resources, such as the key facts and figures about health and social care, which show, for example, how much money is needed to run our NHS for a certain time period. So on this slide, it says that £1 billion is enough to run the NHS across England for 2.4 days, or to fund our adult social care for a certain amount of time. So on this slide, it says that £1 billion is enough to cover 15 days of adult social care spending by local authorities. On the next slide, we give an example of another reason why members of the public would like to gain an interest and understanding in health and social care costs. And it could be for those who are interested in applying for private health insurance policies. So there are various interactive tools on the internet. This is just one example, which we are not promoting or advocating, but really just demonstrate the various costs of health and care scenarios, all of which can give someone an idea of how much the costs would be in the absence of our NHS or in the absence of private health insurance. So on this slide, we have an example of an insurance provider, and it shows how much different surgical procedures or appointments might cost, and really to give someone an idea of what the costs could be covered in an annual insurance premium. On the next slide, we've got another example here, and this is really where some people may be interested in the costs of health and social care when it comes to making decisions about social care provision, especially for a relative, or for holding their local authority to account when it comes to social care spending and commissioning. So on the next slide, really what we are showing with some of these examples is often these invisible costs that exist for health and social care. And there is this notion that by providing members of the public with some of this knowledge, there could be an increase in public responsibility. So say, for example, choosing the right course of treatment, which could be choosing to see a pharmacist instead of a GP for a certain condition, with some NHS campaigns highlighting the difference in costs between, say, self-care for pain, which example on the left-hand side here shows that this could cost as little as 59p, say for paracetamol, compared to an A&E visit, which can cost anywhere from £64. Or, as sometimes we see when we're sitting in our reception area of a GP or a dentist surgery, really there are often these campaigns highlighting the cost impact of missing a GP or a dental appointment. So on the next slide, what we have started to do as a programme is write a blog to this effect, which is titled Bringing Unit Costs to a Wider Audience, Making the Invisible Visible. So really what we're hoping to do together with sort of blogs and presentations and webinars like this one today is just start to make some small steps in making the unit cost programme more visible and relevant to people who use health and social care. And what we will do probably at the end of this session is send you a link to this blog for anybody that will be interested in reading this a bit further. Oh, perfect, Alan, that's great. Thank you. So now I'm going to pass over to Helen, who will talk a little bit more about the specifics of the research programme and the research that's involved within the unit cost of health and social care.
Thank you very much, Sarah. My part of this presentation is to talk about how we've managed to involve PPIE and research advisors, that's members of the public, in this research. It's absolutely been fundamental to everything that we're doing. And if you could go on to the next slide, Alan, you can see that well, this reflects the current team, the names on this slide, but most of the people included on this slide were actually involved in the initial bid. So in about 2021, the NIHR, that's the National Institute for Health and Care Research, which is a major funding body funded by the Department of Health and Social Care, issued a competitive funding call for researchers and groups to submit applications to run a 5-year programme on the unit cost of health and social care. So as a team, we put together a bid, and this involved our research advisors, our members of the public. So we see this programme, the contribution of the research advisors threaded absolutely throughout the concept, the design, and then the delivery of the programme. And you can see that this programme is running for 5 years. If you could go to the next slide, thanks, Helen. So I wanted to really just tell you a little bit more about what we're doing and how we're doing it. So I thought I'd just start with really the outputs, because that's quite a sort of tangible thing, I suppose. So each year we produce unit costs for the most up-to-date financial year. So I think somebody asked in the chat about, do we use inflation indices? If we don't have new new cost inputs for our unit costs, we inflate them using relevant inflation indices, for example, for the health and social care. We produce those estimates and we put them online in a PDF as a manual each year, so they're freely accessible to everyone. And there is a programme website on which these unit costs are housed. And on that website, people have the opportunity, because we provide a contact address to give us feedback. We're very keen on that. Sometimes with some of the web pages, there's also sort of feedback pop-ups as well. We run webinars like this one. This is our third of this programme. We're writing blogs. We've written, I think, a couple now, and Sarah talked about one just now. We're also doing various forms of sort of presentations, whether that's to all different types of users, really, decision makers, academic conferences, but possibly we're going to try and do some sort of broader conference dissemination too. So those are just examples of the kind of outputs that we deliver. And what is the rationale for the work programme? Well, it's to produce these unit costs of health and social care services for use by decision makers and analysts. And the way I see it, in a way, as members of the public, we're all decision makers and we do our own analysis. So when we decide, oh, I need a GP appointment, it's us that makes that choice. But when we access services, we don't pay for them at point of use. So this is delivered under the NHS system. It's delivered free at the point of care. But private care is something else. But a lot of the unit costs that we provide relate to the NHS and social care. Next slide, please. So I'm just going to very briefly talk about the 5 components of the unit cost programme. And really, I suppose central to everything is to produce the unit costs in the best way possible. So we want them to be as comprehensive, as current, and as high quality as possible. So how do we do that? Well, first of all, we want to understand what's available and what's wanted. And we also want to enhance the offer. We want to make the most of the available evidence to reflect that in the unit cost that we produce. And threaded throughout that, we engage with people such as yourselves and in particular our research advisors. Next slide, Alan. So starting with the first component, the first work package, which is to understand what's available and what users want. Well, so what unit costs are we talking about? Well, we have unit costs of services and also of the workforce. And we want to find out, what else do people want? We produce the unit cost manual. Well, there are new services that are being delivered and available through the NHS, for example, every year or over time. For example, more and more online services are available. So people have suggested that it would be good to reflect that those new service developments in the unit cost. So it would be possible, for example, to have a unit cost of a GP service, that appointment that was delivered online. Further to this, there is also new data being made available, and the government has invested hugely in new data, and there's more sort of computing capacity and more ability to link different data sets. So we access some of those as part of our research, and there'll be new data that we can potentially access as well for exploring that. And we also, each year in the published literature, there are new estimates of unit costs that have been developed by other teams, and we want to make the best of that literature as well and that evidence. So, for example, how do we involve members of the public and our research advisors? Well, we undertook a survey. This is a couple of years ago now, and we asked them what new services do you think there are that we could provide unit costs for, give us ideas of new unit cost informative data, for example. So we reported on that survey a couple of years ago now in the unit cost manual, and members of the public fed into that survey. Another example is a scoping review that is almost finished, but it's been a lot of work with over 300 studies that we've looked at and extracted data from. And this has been absolutely informed by all our research advisors to make sure that it's as clear as possible for users, and so it's as useful as possible. Next slide, please, Helen. So the second component is about enhancing what we offer. And again, we've consulted users, and there are pop-ups for a lot of what we do to get some sort of user satisfaction, if you like, to try and understand if it's working for people. And one of the ideas was that although we produce a unit cost manual every year in the form of a PDF, but actually it'd be really nice if people could be interactive. They could use the unit costs, but perhaps could reflect their own ideas on different resources which have different costs as components within those unit costs. So we've developed that now, and we've undertaken a webinar where we discussed it, and we've got sort of user guide for that as well. So that throughout has been threaded the input of our research advisors to make sure that we make it a useful tool at the end of the day. Next slide, please. So the third component of the research is to think about as perhaps the more kind of researchy aspect of the programme, where we're trying to improve the way we calculate unit costs. And we're sort of informed by our advisors and people such as yourselves about what matters to people. So, for example, you know, people might say, well, I live in Doncaster, and you produce the standard costs for GPs on average across England, but I want them to relate to Doncaster, and I have some costs locally that I could put in, and then I would like the unit cost estimated for me based on that. So our unit cost adjuster can do that. That's just an example where we're responding to users' views about wanting to make the costs that we produce locally relevant or relevant to the user, whoever that is. Next slide, please. And all this really comes together through the sort of the golden thread, if you like, of our research advisors and more generally the public. So, you know, just to reiterate what the others have said, to thank Debs, Doug and Sarah for their contributions. We meet monthly and we have emails between us in the meantime. All the outputs that we produce, we discuss them online, and we've had feedback that we try to respond to and update to make it as best we can for everyone to be able to use and access. Because this is really important, and I'm sure you'll all agree that, you know, to adhere, for example, to the principles of equality, diversity, inclusion, to try and reflect, you know, all the different people's views, and all this comes together in the form of the unit cost publication, which is at the centre of the diagram on the right. That's a quick whistle-stop tour of the unit cost programme itself, and I'll hand back to Sarah. Thank you.
Yeah, thank you very much, Helen. So I was just going to have a couple of slides really to talk about our public involvement and engagement work, because really this is the first time with this new collaboration with the University of Kent and York that public involvement and engagement activities have been integrated through this programme, and it is quite challenging. It's very quantitative. There's lots of data, numbers, calculations. So really, I just wanted to give an example of how we've been able to do this, how we've been able to involve our research advisors in this work. So as Helen mentioned, we have monthly project team meetings, we have yearly advisory group meetings, and we also have a lot of kind of ad hoc meetings. So for example, planning this webinar today, this has involved the whole team, including our research advisors. We have quite a lot of what we call the outputs from this programme. So we produce logs, we have the yearly manual, which has all of the costs each year in. We apply to go to conferences, we produce scientific papers, and all of these need reviewing by not only the researchers, but also our research advisor team. And then we have well, actually very initially, the actual funding application for this whole programme of work. This was planned with our research advisors, as were kind of some design elements, so designing our websites. We've also got an infographic as well. So these are just some examples of our PPIE activities. And on the next slide, what we have done is actually look what the impact of this is. So this is just a real small excerpt of a kind of a bigger log, as we call it. And it's really just to show how all of these activities have had a positive impact on improving accessibility, improving our engagement, really sort of improving the content of our outputs and increasing the visibility and the dissemination of our research. So what we do is we just kind of note each activity where our research advisors have made their suggestions and contributions, and what this actually means in terms of improvements for us as a programme. So all this demonstrates the impact of our PPIE team on the programme of work. Thank you. I think I might hand back to Helen at this stage for the last part of the presentation. Sure.
Thank you, Sarah. Yeah, so I mean, this is an illustration of a unit cost manual that we've produced as a team, and you can see that we're all named on there. There are some people who are not part of this team now, but we everyone here will be reflected in the latest version. And this just gives you an example of you know, how valued, I suppose, or interested people are in the unit cost manual, because Alan did some sort of data analytics for us, and we saw within a period of about 6 months that there were almost 8,000 views of the 2022 version of the manual, and this came from 89 countries. As I understand, there are about 160 in the world, so about half, which is, I find, mind-blowing, really. But it's exciting because I think, you know, the more that this manual is used, the more that the unit costs are used, the more value that we extract from the research and the input from the research advisors and the research team that have tried to make this programme as good as possible. Alan just did some investigation as to how people accessed our information on the web, because it's always interesting to find out how are we found. And you can see some examples there. Some people ask Teams Chat or ChatGPT, some of these sort of AI tools. But it's also through the UK government and through the NHS. So that's interesting to see sort of where some of our main stakeholders and interest groups are. I don't know if we've got another slide. Is that it, Sarah?
Yeah, I think that might be it. That's great. Thank you very much, Helen.